Hello everyone. Now we are going to discuss about a very important topic which will come as short notes or either very short also, and it is very important in Viva. Uh, it is planning cycle, and I am Dr. Anusha, Assistant Professor in the Department of Community Medicine. Now we will see what is planning. Planning is nothing but formulation of plan. That means we are writing up how to do, like how to do, what to do, within how much time to do, like that formulation of plan. And this plan is a blueprint of taking actions. That means what actions we are going to take. So it will be written as blueprint, and it will have five major elements. Like we have to formulate prior objectives and goals, and we have to formulate policies or guidelines for decision making, and we should make programs to achieve the goals, and we should follow the schedules, like within this much time period only we should complete this action, like that. And we should do all this within the allocated budget. So these are the major elements in planning. And we'll see what is planning and what is management. Planning is for tomorrow. So, tomorrow, what to do? What next to do? After this activity, what next activity is pending? So, like that, planning will help for tomorrow, and management will help for today. Management means are we doing the activities correctly? Are we going in the right direction or not? Are we going in the pre-planned direction or not? To know that, management will help. So planning is for tomorrow and management is for today. And what is the purpose of this planning? So why should we plan beforehand? What is the purpose? Because first thing is to match the limited resources with many problems. So many diseases are there in the community, many problems are there in the community, but the resources are limited. Resources like MMT, money, manpower, time. So these three are limited. So with limited resources, how to solve many problems? So to match the limited resources with many problems, planning will help. And second thing is to decrease or to eliminate the wasteful expenditure on unnecessary things. This planning will help because we are fixing what to do, what to invest in. Priorly only we are fixing, so it will eliminate wasteful expenditure. And third purpose is to develop best course of action to accomplish an objective. So priorly only we are fixing the objectives and goals, and we are working towards achieving that objective and goal. So what is the best course of action? How can we achieve that objective or goal in a best way? We are fixing priorly only with help of planning. So this is one more purpose. And planning majorly include three steps. Other steps are also there, but the major steps are like, first we should formulate the plan, and we should implement or execute that plan. And after implementing, whether we have achieved the objectives and goals or not, we will evaluate. So first is formulation, second thing is execution or implementation, and third thing is evaluation. We will think that this planning cycle will be useful in only to solve health problems, to be useful to give any new health services, like that we will think. But in reality, this planning cycle will work everywhere. Even for example, a third year student who is trying to pass this community subject and preparing a plan and implementing plan and finally passing, like that. Or a person is going from one place to another place preparing plan to go, like that. In every scenario, every situation, this planning cycle will work. And this planning cycle we are utilizing to give health services in health sector. And if even before going into steps of planning cycle, first we should have pre-planning. Pre-planning means first we have basic idea about what we are dealing with, what is the health problem, and where we are giving health services. We should have basic idea. And not only that, this pre-planning includes government interest, whether it is according to the government interest or not, whether it is against the government interest, or is it according to the legislations or laws, is it against the legislations or not, whether we have planning and administration setup to implement this plan. So we should take care of all these. Say for example, village X is there. So their population is more, and in one family average they are having 3 to 4 children. That means large families are there, and we want to implement family planning programs, whether they are terminal methods or spacing methods we want to implement. And first, as a pre-planning, we should see whether it is according to government interest or not. So whether government is willing to give funds in that or not, we should see. And whether it is according to legislation or not. That means directly we cannot drag the couple who are having 3 to 4 children, and we can't directly do sterilization in them, because we are having human rights. So instead, we can create awareness, we can create what are the disadvantages of large families. Like that, we can create awareness, we can change their attitude, and then we can do this family planning approaches. So it should be according to the legislation, not against it. And we should have organization for planning and administration. That means we should have some health team set up, we should have manpower, we should have funds. Say for example, we want to create one innovative research or new health service we want to give, but basically we are not having manpower to conduct that. How can we conduct? So this is prerequisite. We should have proper organization for planning, administration, and implementation. So this is about pre-planning. First step in the planning cycle is analysis of health situation. We only had basic idea about the health problem and about the population, and now we should collect in detail information about that village X and their statistics. That means how many population are there in that village X, and how many males are there, how many females are there, how many eligible couple are there in that example. And we should have if it is about other problems, then we should have statistics of morbidity and mortality. That means what are the prevalent diseases in that community, and what are the mortality rates, and we should have knowledge about their epidemiological indicators. And so what are the medical care facilities are there. So then we can utilize those medical care facilities to implement our plan. And how many manpower are there? So to conduct any health program, we should have manpower. So manpower means in that example of family planning, so medical officer should be there, ANM should be there, then health educator should be there. Like that, we should have sufficient manpower to implement any program. And how are their attitudes and beliefs? So we should collect in detail information about all these factors. So this is the first step of planning cycle. After analyzing the health situation, the step 2 in planning cycle is establishing goals, objectives, and targets. First is we will see what is goal. So goal is the ultimate desired state towards which all the objectives and resources are directed. That means ultimately what we want to achieve. So in the previous example, decreasing the population in that village is our ultimate goal, and this goal will be for long term. So set point formed for a long term plans, and it sometimes it cannot be quantified, and sometimes we can achieve this goal and sometimes we cannot achieve this goal in time. So that is about goal. And next thing we will see what is objectives. Objectives means planned endpoints of all activities. So in the previous example is our ultimate goal is to decrease the population in that village X. And what could be our objectives? To conduct the sterilization camps, to conduct the awareness about the spacing methods and sterilization methods, and to conduct camps regarding spacing methods, like that. So this could be the objectives. And to change their attitude and beliefs about family planning in a positive way, so that could be also an objective. So it is planned endpoint of all activities. So each and everything is one objective, and it is precise and concerned directly with the problem. So as in the examples given, to change the attitude and beliefs about family planning methods, so this is also directly concerned with the problem of increasing population, like that. And these objectives are established after cost benefit analysis and input output study. That means if any method is approved through cost benefit analysis, that means with the cost we are keeping, it should be beneficial. So that is cost benefit analysis. So after this analysis, if that method is useful, then only we will implement. And next is target. So target means discrete activities used to measure the extent of attainment of objectives. So to achieve each and every objectives as milestones, we should keep these targets. Say for example, in the previous example, so to conduct sterilization camps, so in that village X, so in that, in the first 6 months at least 10% of the target couple should be sterilized, and in the next 2 months remaining 20% of the target couple should be sterilized. Like that we will keep some milestones. So they are targets, they are discrete activities. So after all these targets are reached, then only we can complete one objective, and if we complete all the objectives, then only we can reach the goal. So goal is ultimate, after that objectives, and to achieve these objectives we should keep some targets. And these targets are directly concerned with factors involved in a problem. And so this we should see whether our targets are achieved or not. So you understood now. So targets are small milestones we will keep, and we will try to reach the objectives. And objectives we will attain one after the other, and ultimately we will achieve our goal. So this is the order. So this is very important for very short as well as Viva also. What are goals, objectives, and targets? Third step in the planning cycle is assessment of resources. That means how much resources are there. Resources you can remember like MMTS. S will not be there. MMT. So money, manpower, and time. So we should see the balance between what is required and what is available. So to solve the health problems in particular community, we should need more resources. But with available resources, what can we do? We should think and we should plan according to the resources available. And next step in the planning cycle is fixing priorities. Say for example, in that village X, many health problems are there, many diseases are there. Say for example, rabies is there, vector borne diseases are there, this population explosion is there, many problems are there. But depending upon the resources available, and we should think, and diseases which can be prevented at low cost we should choose. Both are importantly equal public health problems. In that scenario, we should select a disease which can be prevented at low cost. And there are two different diseases which are of public health problem. One is concerned to oldish persons, and one is concerned to young persons. So in this scenario, we should select a disease which will save younger lives rather than older lives. So priorities will depend upon the situation in that area or disease in the context we are talking about. So finally, we should fix our priorities according to the disease or health situation in that community or village X. So in the last step, even we fix the priorities. Say for example, we thought of doing 100 things, but according to the resources available, we finally fixed to do only 70 things. Like according to resources, we cut down some. So to do all those also, next in the next step, we should formulate a plan. So that is the next step. So once the priorities are established, so the plan for achieving them are formulated and assessed. That means what to do, how to do, and within how much time we should complete. That is nothing but time needed to implement the plan is calculated, and how much resources are needed, like how much money is needed. Say for example, in that village X population, in family planning method, say for example, we need 2 lakhs for bringing the spacing methods, and to give the salaries to the manpower like that, and we should fix how much time will be needed like that, how to proceed in detail we should write down. So that is formulation of plan, and this formulation of plan is the most essential step in the planning cycle. Like randomization is the heart of the randomized control trial, formulation of plan is the heart of this planning cycle, because if we are creating a detailed plan and correct plan and we are implementing it correctly, then we will achieve good results. And this planning step will bridges the gap between strategic thinking and execution. And in the previous example of decreasing population in that village X, how many manpower to recruit, and how much time will be given to train them, and how many antara injections to bring, how many condoms to bring, and how to create awareness campaigns like that. We will write each and everything in detail. So that is formulation of plan. And next step in this planning cycle is after formulation of plan. Next thing what is remaining? Implementation. Program and implementation is next. So till before step we have only written everything down on paper only. So we did not proceed in reality. But this step is the reality, that is implementation in the field. So in reality, we will go and select the manpower and we will train them, we will motivate them, we will supervise them like how they are doing their roles properly or not, and we will even write down their roles and responsibilities and what tasks they should do. So like that we will see. And in implementation of a program, best thing to do is discuss with people in community than to decide according to it. So that means in the previous example of village X, then we thought that stigma is more for vasectomy especially, and sterilization, and their awareness is not there, we have seen. So instead of going directly into that village X and conducting awareness campaigns directly, so first we should involve the local people. So that is nothing but community participation. We should talk with local people, and why they are feeling it as a stigma, and why they are not utilizing the free services which are there in the primary health center, like condoms, antara injection, sterilization things, why they are not using. So their perspective we will see, and we will talk and we will discuss with them, and we will list out the problems what they are facing, and we will try to rectify it. So that is nothing but community participation. So same in the example of village X, program and implementation is nothing but the same. This training, selection, motivation and all. So already we have discussed. And in this implementation, community participation is must. Any program will be successful with community participation. And next step in planning cycle is monitoring. That means we are implementing the plan what we have formulated, and while implementation, whether this plan is going according to the preformed design or not. How can we assure that? So with help of monitoring we should do. So monitoring is nothing but daily activity tracking. Say for example, we have given task to medical officer to conduct sterilization campaigns, and we have told the ANM to give antara injections like that. We have divided the roles and tasks. So are they adhering to their activities, and are they completing their tasks within the given period or not? We should do monitor. So that is nothing but day-to-day follow-up of activities to ensure whether they are adhering to their schedule or not. And we should identify immediately whether there is any deviation in their roles or not. That means whether they are doing correctly or not. If they are not doing correctly, if there is any deviation, we should immediately correct it. So in the previous example, one group is conducting the awareness campaigns or not, and one more group is conducting the sterilization campaigns or not, and one more group is conducting the spacing methods distribution or not. We should track day to day. So that is monitoring. So monitoring is like CC camera surveillance. So continuously we should check. And last step in the planning cycle is evaluation. That means Plan is formulated, implemented, and it was monitored. And finally, whether what we thought as goals and objectives, whether we have achieved or not, we will see in evaluation. So this is nothing but measure the degree to which objectives and targets are fulfilled or not. So whether we have 100% achieved the objectives and targets, or only we achieved only 60% of the objectives and targets, like that, how much we achieved we will see in evaluation. So we will compare here outcome with objectives. So in the previous example, in that village X, whether we have decreased the population or not, whether we have decreased the total fertility rate or not. So like that, with what is the outcome of our program or planning, we will see in evaluation. And how we will do evaluation means with surveillance. Like data will be collected and it will be analyzed, and finally what is the outcome we will see. And one more method is impact assessment. So whether the impact of this program is there or not. So how we will know? That is also with help of how many targets achieved, how many objectives achieved. So with that we will do evaluation. So evaluation is after completing the project. So in the end we will do evaluation. So till now what we planned and we have done. So after doing everything, whether we have done correctly or not, and how much we have done, how much percentage we have done, we will see with help of evaluation. And if our goal was to bring a total fertility rate to 2.1, and now what we have achieved, so whether the TFR is 2.3, 2.2, or whether we have really achieved that TFR of 2.1, so we will see whether the goal or targets is reached or not. And finally, as a summary, we will see planning cycle. So before planning cycle start, we should do pre-planning. And like whether it is according to legislation or not, whether it is according to government interest or not, what we want to do. So that is pre-planning. So after that, we will analyze the health situation related to that problem. Like we will collect in detail information, and after that we will establish goals and objectives, so through cost benefit analysis and input output study. And after establishment of goals and objectives, we will see how many resources are there, that is MMT, money, manpower and time. So according to the available resources, we should fix the priorities. So whether we should follow with all according to the resources, or we should cut down some and only fix to some things what we wanted to do. So that is fixing priorities, so which are coming at low cost, or which are save methods are saving younger lives, so those will be fixed as priorities. So after fixing the priority, how to do in detail we will write down. So that is nothing but plan formulation. So we should think of a plan which is feasible, so that is implementable plan we should formulate. And after planning the everything, we will program and implementation. So that is nothing but in reality we will implement that. That means we will assign roles, tasks, and we will recruit, we will train them. So and we will implement what we thought, like implementation, in that example, doing sterilization, giving spacing methods, like that, that is implementation. And next, while we are doing all this implementation, we should monitor day to day activities like follow ups. So every 2 days, or every day, every 1 hour, or every 1 week, like that, we should monitor how they are doing, whether they are doing it correctly, or whether any deviation is there. If any deviation is there, we should correct it. So till monitoring, so what we have planned, we have implemented and it is completed. So finally, whether we have achieved the objectives or not, to see that we will do evaluation. So whether the objectives are achieved and targets are fulfilled or not. If we have achieved the objectives and targets, that means this program and this planning cycle is very successful. So if this planning cycle is successful, then we will go on implementing the a program in other villages, or where there is the same problem, we will go on implementing in other places also. If evaluation achieved the all the targets and objectives, we will again continue with programming, implementation, monitoring and evaluation. Like that we will continue. But if we could not achieve the objectives and targets, means our plan was not correct. So then again we should come from starting. Like we should again do pre-planning, we should again do analysis of health situation, establishment of goals and objectives, resources, fixing of priorities, plan formulation, programming, implementation, monitoring and evaluation. Again we did not achieve targets, means again we should continue from pre-planning. But if we achieve all these, means again we should continue with implementation thing. So this is about planning cycle in detail. So like, share, subscribe, and comment down if you want any specific topic for explanation. I'm Dr. Anusha and you are watching Community Medicine Made Simple. Thank you.